epilepsy? What is epilepsy? Epilepsy is a brain or neurological disorder that affects the nervous system. It causes disruption of senses, unconscious seizures, and abnormal electrical patterns in the brain. Nerve cells within the brain, called neurons, commonly communicate with each other through cell junctions called synapses. One nerve cell sends a chemical signal to a neighboring cell, which then activates an electrical nerve impulse within the receiving neuron. Together, the series of electrical impulses allows for proper brain functioning. Epilepsy develops when a nerve cell loses the ability to turn off electrical impulses, leading to overstimulation of certain areas of the brain. The disease can affect multiple centers of the brain and cause a range of symptoms.
Types of seizures. 1. Focal seizures start with one part of the brain and affect the part of your body controlled by that part of your brain. 2. Generalized seizures involve the whole brain and body. Absence seizures. Person is unaware and unable to respond. Person may stare, flutter their eyes, and their eyes may roll back. Myoclonic seizures. Shock like jerks of muscles. Atonic seizures. Decreases normal muscle tone, causing the person to fall. Tonic-clonic seizures. Person stiffens. There are irregularities in their breathing, causing vocal sounds, strong movements, urine and/or fluids from mouth. After the person regains consciousness, they may be confused, drowsy, or depressed. Usually lasts 1 to 3 minutes. If more than 5 minutes, you must call an ambulance. Epileptic spasms. Brief movements. Convulsive seizures. They are the most dramatic type of seizure, causing rapid, rhythmic, and sometimes violent, shaky movements, often with loss of consciousness. These can sometimes start in one part of the brain, causing one part of the body to move, and then progress to the entire brain and movements on both sides of the body. These seizures usually last for 2 to 3 minutes and will almost always end on their own. The causes of epilepsy are genetics, head trauma, brain conditions such as tumors or strokes and vascular diseases, infectious diseases such as meningitis, inflammation of brain and spinal cord, development disorders, age, alcohol, seizures from childhood, and dementia.
Possible future treatments. Deep brain stimulation. Electrodes connected from brain to skull or chest. This sends electrical pulses to brain and may reduce seizures. Pacemakers. Detects seizures before they happen and sends electrical charges or drugs to stop the seizure from happening. MRI. Guided laser ablation. Less risks than normal open brain surgery. Stereotactic radiosurgery. Direct radiation to specific part of brain that is causing the seizures to occur. Treatments. Drug therapy. The majority of children with epilepsy can control their seizures with anti-epileptic drugs, which act on the brain cells to make them less likely to fire. Temporal lobe resection. In this surgery for epilepsy, brain tissue in the temporal lobe is cut away to remove the seizure focus. Like any surgery, this one has multiple risks, which include damage of certain parts of the brain, which can result in paralysis or speech problems. Multiple subpial transection, MST. A surgery used to control brain seizures in people with epilepsy who don't respond to medication. MST stops seizure impulses by removing nerve fibers in the outer layers of the brain, sparing the vital functions concentrated in the deeper layers of brain tissue. However, there are side effects that deal with an MST. For example, it can cause scalp numbness, nausea, feeling tired or depressed, headaches, difficulty speaking, remembering, or finding words. Vagus nerve stimulation. For this epilepsy treatment, a doctor implants a pacemaker-like device in your body to stimulate the vagus nerve, which runs from your brain to your torso. When evaluating this method of treatment, there is one main risk of this pacemaker-like device. Since it will be in close contact with one's tissues and organs, they have a high chance of causing infections, damage the vocal cords, causing speech difficulties, affect your breathing, and as well as slow down your heart. Although this is rare, there is a chance that the stimulator may even stop your heart, which may result in heart attacks and strokes. In terms of lifestyle, This may be very irritating and frustrating for those that travel and have to go through metal detectors. Some cultures and religions may also disagree to this treatment because it is not a natural way of our body functioning. It also costs about $20,000 to make these stimulators. Therefore, people who live in countries without free healthcare may have to pay a lot of money for surgery to cover the cost of this as well. Possible future treatments. Deep brain stimulation. Electrodes connected from brain to skull or chest. This sends electrical pulses to brain and may reduce seizures. Pacemakers. Detects seizures before they happen and sends electrical charges or drugs to stop the seizure from happening. MRI. Guided laser ablation. Less risks than normal open brain surgery. Stereotactic radiosurgery. Direct radiation to specific part of brain that is causing the seizures to occur.
The symptoms of epilepsy are confusion, loss of consciousness or awareness, and jerk of movements.
SUDEP, sudden unexpected death in epilepsy. SUDEP is the sudden unexpected death of someone with epilepsy who was otherwise healthy. In SUDEP cases, no other cause of death is found when an autopsy is done. Each year, about 1 in 1,000 adults and 1 in 4,500 children with epilepsy die from SUDEP. This is the leading cause of death in people with uncontrolled seizures. What happens? The person with epilepsy is often found dead in bed and doesn't appear to have had a convulsive seizure. About a third of them do show evidence of a seizure close to the time of death. They are often found lying face down. No one is sure about the cause of death in SUDEP. Some researchers think that a seizure causes an irregular heart rhythm. More recent studies have suggested that the person may suffocate from, for example, impaired breathing, fluid in the lungs, and being face down on the bedding.
What do I do if I see someone having a seizure? Don't panic. Usually after a person has a seizure, they may be confused, so panicking will not help. Move any harmful objects away from the person. Roll the person onto their side because they may choke on fluids. If they are unable to do so, do this after the person is calm. Call the ambulance. Do not try and stop their movement. Try and place a sweater or cloth-like material under their head to avoid head damage.
That's all, folks.